so that is done now. Amanda and the team are going to deliver the main part of the webinar this evening. I'll pass over those in just a second. Just one quick point for you all. If you've got any questions as we go through the webinar, please pop those questions into the Q&A box. You'll see that on the bottom bar, and we'll pick up those questions in a Q&A session at the end. There's also a chat function, so if you've got any problems with the platform at all, or any questions about how Zoom webinars work, please pop them into there and we'll pick up those as we go along and help you out with those. So with that now, I shall hand over to Amanda, and she will take over from here.
Thanks very much, Louise. I want to say a big thank you to Louise and her team for setting up this webinar tonight. And I should really introduce myself first. So my name's Amanda Marshall, and I'm a vaccine policy lead at the national NHS England team. I also wanted to thank Sati and the team from the Northwest for supporting this proof of concept, and also to thank you guys for one, expressing an interest to participate in this proof of concept, and also two, for joining us tonight. The proof of concept came about following feedback which Illyri, I guess, may talk about later on MBS from the COVID vaccinations, from patients saying that they liked it and from sites finding it useful. So we're hoping that we can, through this proof of concept, trial MBS in other vaccine types to see, where we can take this platform for the future. And in that, we would also hope that you guys will benefit from using the platform, in that you'll be able to, plan workforce, plan your vaccine supply, and hopefully it will help with some of your admin around booking patients in. We also think that it offers patient choice, and also maybe later in the vaccine season, it will show patients where there is still vaccine available for them to get their jab. Other benefits really to the NHS are also to help with winter pressures, to ensure that the at-risk cohorts and the 50s and overs all get their vaccine, so that we're prepared for anything that the winter throws at us this year. It could be quite a cold one, I think. And I wanted to say one last thing. Oh yeah, it was to test the capability of MBS. So thank you very much for everyone joining us tonight. I hope you find it useful. And I'll now pass over to Illyri for a bit more information on the booking journey. Thank you.
Thank you, Amanda. Hello all, my name is Illyri Adewale. I am an Associate Product Manager in the National Booking Service team, and I'm the manager for this flu booking journey. So as Amanda mentioned, this proof of concept came from research following the COVID booking journey, so research with citizens and staffs at vaccination centres, community pharmacy, GPs, PCN sites, to see what were the learnings that we could get from flu, and how we could improve the flu booking journey. What were the learnings we could get from COVID, because we didn't have a flu booking journey at the time, and how we could use those learnings to support any other vaccination programs, which included a flu booking service. So this flu booking service is built upon the success of the COVID booking service. We've had a full round of user research and usability testing for me to share the prototype that I'm going to share tonight. And it's tested quite well. As Amanda mentioned, there's quite an appetite for citizens and amongst staff to have a national booking service for flu. We know that there are other local and other booking systems out there, but for patient, there was a real need to have something that was centralized. Patients kept referring to the NHS, being able to book on the NHS. So this flu booking service will support the needs that citizens have from that. So I'm going to now share my screen, and I'll be walking you through the prototype of the citizen booking journey. So this is what the citizens will see when they go to book their flu jab. So I'll say straight away, a lot of the things you see here tonight, depending on how familiar you are with the COVID booking journey, will be very, very familiar. Because we didn't want to sort of reinvent the wheel. We wanted to learn from what we've done for COVID and see how it would be applicable for flu and develop that. And once again, it tied in with the citizens, the users' experience of having booked with their COVID jab. They're quite familiar with, you know, what the NHS looks like, the user experience of the NHS. So we wanted to keep that familiarity for citizens, and so, you know, they have that trust in this booking journey and the booking systems. So this is a start page the user will see. We straight away call out where the user would be able to book their vaccinations in. So book the proof of concept is booking into pharmacies. And early on, because of the wide reach of the COVID booking journey, being able to book, you know, at large vaccination centers, PCN sites, and different locations, users came with the expectations that they would see that. But for the proof of concept, it's pharmacies right now. So we wanted to call that out straight away and set the user's expectation from the word go. So on the start page, we keep it quite short and relatively simple, just informing the user of the current eligibility rules for flu booking. Now, I do understand that the 50 to 64-year-old non-at-risk will be in mid-October. So, and this service will be going live to coincide with those dates. So when this goes live, when the user is jabbed for the service, the age will be they'll be eligible for it. We don't go into the full details on the health, the at-risk groups and explaining eligibility there, because there are other services within the NHS that delve into that, and we do signpost the users to those services as needed. So once the user wants to book an appointment, they can click the book now. We do a PDS check, so quite similar to the COVID journey, just to check, you know, previous records, NIMS records, that the patient has, you know, an NHS number is associated with the GP. When we check the user's NIMS record, we want to ensure that they haven't been vaccinated in this current flu season, to ensure that, you know, people aren't, you know, double booking and potentially being jabbed more than it's clinically advised for them to do so. So if the user hasn't had a flu jab in this season, then they're able to book on MBS. I'm just going to use some dummy data here. So should we move through? I'm just going to show what happens if the user. So currently we will do an age check. Once the user puts in their age, we'll also do an age check. And if the user is over 50, then they can book straight away. But if they are under 50 and need to declare the reason for their book, we give the user the opportunity to self-declare as being eligible based on the information. Okay, so if the user is under 50, as previously said, we iterate the information around eligibility and just have the user confirm whether or not they are eligible. Now, we know that if they're not eligible based on being in the at-risk group, then they're not able to get a flu jab on the NHS, and we inform the users of that. So I'll just quickly show that. And we signpost them to get more information about the flu jab. But if they are eligible, then they're able to declare that information and go ahead and book. So here they'll find a community pharmacy that is close to them. They're able to filter based on access needs. And then they're able to select a community pharmacy that they'd like to be vaccinated on based on availability that the community pharmacy in their locale provides. We choose a date and choose a time range, time slot. We give them the opportunity to provide contact details. Just going to quickly show what that looks like. If they say no, we prompt them for the reasons why, because we do send them reminder notifications and confirmation of their booking. So it's quite important that the user has that information, just to have the assurance that they have in fact booked, and to ensure that if closer to the time, for whatever reason, they need to cancel their appointment, we send a reminder notification 24 hours before the appointment, and the user is able to cancel up to an hour before the appointment, so that they're able to do so with ease and free up any vaccinations that won't be used after they've booked, as I understand. Okay, and that's it. That's the complete booking journey. They have the opportunity to make note of the booking reference number. So if you're utilizing the checking app, they can be checked in, or just however it suits the operational model of the pharmacy. We also provide information about the location of the site, and as I mentioned, these informations will be sent in notifications to the user closer to their date. So that is what I call the happy path of the booking journey. I'm now going to hand over to Amanda. I don't know if there are any questions. Should we wait until the end? Yeah, okay. All right, then I will hand over.
I think you might be going straight to me, so I'll jump in. Hi, everybody. I'm Danny. As kind of echoing what Amanda said, I appreciate you all joining us this late. I work within what we call the MBS onboarding team. So that's basically making sure that sites are onboarded onto MBS and Qflow, and ensuring all their details are correct, providing assistance, that kind of thing. I'm hoping that the vast majority of you will have received an email from me this afternoon, and in that email it will include kind of like a link to login details, links to guidance, and some kind of flu specific guidance as well, because our online guidance is tailored around COVID, and there are some differences and intricacies, but I'm going to talk you through those today. So I'm going to switch on now to Qflow. So this is the back end of MBS. So what Illyria is showing you is very pretty and lovely. There's a patient-facing side of things. And Qflow is candidly not as user-friendly, but hopefully once you get your head around it, it is very repeatable, and it's kind of the same. In the comms that we sent out, we said that we're running special drop-ins next week. So if you do log on through the email that I shared with you and you are having any issues, please do come to any of those drop-ins, and I'll be on hand to kind of assist you with any of your setup and that kind of thing. So I think I'm sharing my screen correctly, but if not, someone please shout. So yeah, based on the email I've sent you, you click on the link, type in your email address, password, and you get logged into Qflow. Yours will look different than this in that you will only see probably one single site, or you might see a few sites if you are kind of a chain as well. The first thing that I would ask you to do is to kind of locate your site and check that the details are correct. So you can do this through administration, and then you go to organisation, and then organisation tree, and then you'll click on your unit. That's where I was before. So you'll see your site that will look just like this. It will have your address. Your external reference is your pharmacy ODS code. Yours, of course, will say community pharmacy, and it'll be active. What you will also have is you'll see that you have users. This might be different if you have a number of sites, because they might be at a kind of a top unit level. You'll see users here, and you'll also see services. You guys should just have flu vaccinations. The main thing really that we're checking here is that all of your details are correct and that kind of thing. If there is an issue, I guess we'll flag it to your region and they can get in touch with me. So the best thing probably to do after that is to go and check your content management. Now, on the patient booking journey, Illyria went through and showed you like if patients have particular requirements, if they need to be close to a bus stop or that kind of thing. In order for that to show the correct details for your site, you have to set up some things in content management. Now, I have all of these things here in my favorites. So it is like a top tip I'd say is just to add these like pages that you use frequently to your favorites. A lot of the stuff on here you won't use, because we didn't design QFO perfectly, and we use something that's kind of off the shelf. So that's just to be aware of, that there'll be loads of things on there that you won't use, and kind of not to worry about that. So content management, for this one, you go to design, content, and then content management. And then, as I say, once you've done it, it's probably worth favoriting it. Now, I'll go again to our test site. Apologies for the beeping. Yours will look slightly different to this, in that there are some that only I see as an admin. So you wouldn't see like allow 12 to 15, allow 16, 17, etc. Actually, you will see allow 16 to 17, but it's not applicable because we're only vaccinating patients 18 and plus. But yeah. So what you need to go through on this is you need to look at the different attributes and assess it based on your site. So do you have an accessible toilet? If you do, you'll press this little yellow button here for the drop down actually option to appear. So you can do that, and then you can set it true. Make sure you click save in the top corner for that to be kind of saved and pulled through. What you'll need to look at then as well is your like longitude and latitude to check that they're accurate. You can just go online and do like a postcode converter just to double check. It should all be okay. But this is the thing, that when people type in their postcode, pulls up your site. So if your longitude and latitude aren't correct, people will be putting the postcode of your site and your site won't be appearing. So just make sure you double check that. Once you've set all your content management attributes to true for your site, the one thing that you need to think about is this one here, where it says online, and set true to make your appointments bookable to the public facing booking service. So if this is set to false, your site won't appear, regardless of whether you've added loads of appointments and all of that. Your site just won't show up. Once you've added all of your appointments and you're happy with the setup and that kind of thing, and you've checked your calendar and it's pulling through correctly, you want to come back to content management and set this to true. It's also worth noting it can take a few hours for this to appear to the public. However, we're hoping that you'll be adding availability in the next few days. You'll set it to true so that as soon as we go live on the 10th of October, your site will be there. But just in case you don't do that until after go live, that's another thing to just be aware of. So the next thing that's probably worth me showing you is the diary manager. Diary manager is one of the things that actually you can't save to favorites. I don't know, it's a little bit of a bug, but you just go to site manager and then go to diary manager, and it will take you to this page. Now again, you won't have the same full list as me, so hopefully it's a bit easy to kind of navigate. But what you will do is you'll see your site, and then you'll want to press the little plus to the side, and then again underneath you should just have flu. So you'll click on your flu, and this is where you add your availability. So we're asking that you add availability from the 17th of October. So if we go here and I type in 17, oops, and then I go October, and say you're kind of confident in your vaccine supply for 4 weeks. So I'll say, let's go until, this probably isn't perfect, but let's go until a month out into November. Now, what I've said here is that I want this to repeat weekly. Essentially what this means is that I want to set my availability period for a week, and within that period of time, the same appointment availability will repeat. It's just to make your setup easier. That only works if you know your hours. So if you know you're going to be offering flu from 10 until 11 every Monday to Friday for the next 4 weeks, then set it up to repeat. If actually your appointment is a bit more ad hoc, and sometimes it'll be 10 to 11, the week after it might be 1 until 2, you can't do that repeats weekly. You'll have to do those dates kind of individually. It's all up to you as a site as to kind of what works best for you, and whether your, as I say, hours are repeatable and whether you can use that feature. But let's say for argument's sake that mine is, you'll see here then underneath it just has 1 week. So I set my hours for that 1 week, and as I said, then they'll repeat. Let's say on a Monday, I come down here, add my availability time. As I said, let's say I was doing kind of 10 to 11. So I'll start typing that. One thing you need to be aware of is that appointment lengths are set to 5 minutes. So within that period, then there would be, we're testing my maths now, 12 appointments. Max simultaneous appointments means basically how many appointments or vaccinators might you have at one time. So let's say you just have one person. We often get feedback from some pharmacy sites where they say having it set to 5 minutes is kind of too quick. unfortunately, we don't have the ability for you to edit the duration length of the appointment. But what we sometimes advise sites to do is maybe set half an hour of appointments and half an hour off, half an hour off. And in that, you know that some people will be late, some people will be early, and it just gives you that like 10-minute time that you might want for your appointments. And it's much better than setting like 5 minutes, 5 minutes off, 5 minutes, 5 minutes off. Again, if your weeks are repeatable, you might want to invest the time in doing that if it works for you. But yeah, just a few different ways in which you can manage your availability. Now, the thing to be aware of is down here, and these are the different kind of, we call them appointment types. So kind of based on feedback and engagement that we had with community pharmacies, they were saying that these are the 3 different appointment types that are applicable. And in the email that I sent out today, you will have seen I've kind of said these align based on JCVI guidance to certain vaccines. So we anticipate that if you have particular vaccines in stock, then you will pull across those specific appointment types. So let's say, for example, I only have a certain vaccine type, so I go for the flu generic, and I'll pull that across. That means that only people who are eligible for that particular vaccine type that you have will be shown these kind of appointments, and vice versa. So if you have all the different vaccines in stock and you have like a sufficient vaccine supply to pull them all across, then that might be what you want to do. But again, this is for you to manage yourself. It may be that you want to do one vaccine type in the morning, one in the afternoon, in which case you might just pull across 18 to 64, and then in the afternoon you'll set your next availability and you might pull across the vaccine type which aligns to the 65 plus. What you need to remember when you're adding your availability is just make sure you press all of the different saves in all the different places, and then press update diary. So it can be a little bit temperamental. So just make sure after you've done that, you go and check in your calendar that it's appeared correctly. So I've in my calendar here, so let me go to month so you can't see any patient data. I'll flip back in a second. Perfect. So within the calendar, again here, this is tools and calendar. So tools up here, and then calendar. Again, once you've got that, I'd recommend you favourite it. I'll go down here to the Royal Vaccination Test and go to flu, and you'll see hopefully that I've had that availability pull through for, it should come through on the 17th of October, and you will see it then repeat every Monday after. So you'll see what I mean by the repeating. In this calendar view, as you can see here, you can see how many of your appointments are available and how many have been booked up. It will appear blue if you've had no appointments booked in, and as you just saw, it'll appear green if we do have those bookings. So you can see when I added the calendar availability just then, I only added in the Monday, I didn't add any of the other days, and I set it to repeat through to the 17th, so it's done all of those Mondays. And as I said, it's appeared blue at the moment because nobody's booked in. So this is what we'd like the calendar to look like at this moment in time. If I click on that specific day, you can see I've done it from 10 until 11. There are a few things that you can do in the calendar. You can, for example, occupy time. If, say, for example, you know that you want to set up your whole week repeating for a month, but you might want 1 or 2 days off in between because you've got staff training or whatever it might be, and it's really, really laborious to add it separately. What you can do is you can go on that particular day and you can use this occupy time feature to block out that one day. But other than that, it's pretty kind of self-explanatory. In the guidance I've shared as well, there's also links to reporting, and you can pull reports in the info centre that show you how many patients that you have booked in and how many kind of appointments that you have left for whatever period you want to see. I'll go back to calendar, because what you can also do within the calendar view is you can pull a list for a day. That was what was first on the screen. And so when you do have patients booked in, you can pick on a single day, and it won't work now. You can click on list basically, and it will show you all of the patients that are booked in, and either you can choose to print it, or you can, once it clicks on print, you can copy and paste it into Excel. That was a bit of a whistle stop tour. I guess my recommendation would be have a go over the next few days. If you've already used QFlow with COVID sites that you manage, great. If you're brand new, try and follow the guidance, look back at this recording, and if you do have any issues, then yeah, please join us on one of the drop-ins on Tuesday or Thursday next week. We do regular drop-ins Monday, Wednesday, Friday, but the ones on Tuesday and Thursday specifically just for kind of your new sites that are new and doing it for flu. I'll stop there and I'll stop sharing my screen, and I think maybe hand back to Amanda or Louise.
Yeah, thank you. Thanks for the presentations. They were great, actually. Really good summary of what it's all about. And we have got a few questions coming in some in the chat and some in the Q&A. So if anybody's got any more questions, please do pop them in there now so we can make sure we get them answered for you tonight. Shall I go through the questions and we can see who's the best person to answer them? Is that okay? So an eagle-eyed delegate has asked the question around the eligibility on the first presentation. Apparently it said social care workers are eligible, but it didn't mention healthcare workers. So will that be being updated, do we know? Or
yeah, so it's our understanding that healthcare workers are eligible based on an occupational health scheme, which is separate. You know, some healthcare workers do get vouchers to get their flu jabs at pharmacy, but the guidance that we've been given from NHS England is that healthcare workers are eligible under occupational health scheme, so that's a separate thing. So they won't be able to book on MBS, and we provide booking on MBS to social care workers whose companies or employers don't provide an operational health scheme for them to get jabbed through.
Thank you. Thanks for that. We've been asked a question. Sorry, go on, Amanda.
Can I just? I'll speak to Illyri about that outside the meeting. There is a small amount of healthcare workers that are eligible, so we can update that.
Brilliant. So the next question that we've got is around how is the system being advertised for the public? How will they know that they can use it?
Okay, so we have been working with the comms team nationally and the comms team in the Northwest. We'll be putting out some comms to patients around this, so we will be promoting it. I think Illyri's told me previously that actually patients go on to the NHS website. You know, if you're looking for various services, they do go on to the NHS website, and so it will be on the first page that they go to be able to book an appointment with a book a flu appointment with a pharmacy will be on that first page. So yeah, we'll be doing some comms, but feel free we're happy for sites to do their own comms if they want to you know, share the link or you know, text it out to their patients. That's fine.
Brilliant, thank you. Because we've got a good few more questions actually as well. So a couple of people asking when will it actually be live to start updating?
So kind of site managers can go on as of now and add their availability. We're asking that they add availability from the 17th. The 17th is the day that patients can kind of have their first appointments and get jabs in arms. But we're saying that patients will be able to book on from the week before. So it's going to go live to patients on the 10th of October, but they will book appointments from the 17th.
That's brilliant, thank you. The next question that we have is around exemptions. This is around the patients booking themselves in. So if they say that they're exempt for anything other than age, so for example they've got the diabetes or respiratory or whatever it is, are we expected to check that with the patient, or do we take their word for it? My view is as part of the clinical check, when the patient arrives in pharmacy, we'll be making that additional check to make sure that they did fall into the eligibility group. Would that seem reasonable?
Yeah, I don't think the MBS system has the functionality to check that at the moment.
We do inform the users that pharmacies at the site, the pharmacy will be checking on that. So users are set with that expectation that someone will ask clinical based questions for them.
Fabulous, thank you. I think this question may have already been answered. I think it came in quite early, and it's probably one that you already covered, Danny, in your presentation around how many patients can you book in an hour. But I think that was probably covered, wasn't it?
Yeah, again, it depends, because if you have like a site with multiple staff, you could put multiple simultaneous appointments. But if you were to just have one member of staff vaccinating for 1 hour, then it would be 12 appointments. But as I say, if that's too many, you can do it so you have 5 minutes on, 5 minutes off, or that kind of thing. So you have like a longer appointment duration.
Fabulous, thank you. I think we've got a question here from somebody who's not received the email with the login details. I'll pass his details on to you at the end, Danny, so you can just double check that.
Thanks, Louise.
That's fine. Then we've got a question here about the consent forms. So is there an option for patients to complete their consent forms ahead of the jabs? No, I didn't think there would be. I mean, you can use pre-consult, can't you, within Farm Outcomes to complete some of that documentation, but there's no option at the moment, is there, through this booking service? No. Thank you. Got a couple of questions coming in around flu stocks, which I think we may need to pick up outside of this webinar. I'm not sure if anybody can help with flu stock availability.
A couple of things. There is no centrally procured stock this year like there was last season, so we haven't bought any that we will be distributing to sites. And as far as I'm aware, the Department of Health work with manufacturers quite closely, and they are telling us that there are supplies in the system, and vaccine supply isn't a problem.
Brilliant, thank you. Again, a question around integration within Farm Outcomes, and that doesn't happen. So information from the booking system isn't going to be uploaded to Farm Outcomes for claims or anything like that, is it? That will be a separate process. A person here is asking what information needs to be added to QFlow after the patient has had the vaccine. Nothing, as far as I understand, is there? They don't need to add anything to the.
No, that's correct, Louise. No,
that's correct, isn't it? Will the programme be supplying the vaccines like COVID, or do we have to source our own? So again, it's just source your own vaccine as you would do in previous years. There's a question here around, do we know when Outcomes for Health will enable flu? I'm guessing that's around the dual module flu co-administration, and we have no detail on that. Susan, I might be able to answer that question because I know she's probably closer to that than I am.
I'm desperate for that button to come back again. We were told it wouldn't take more than a couple of weeks, but it hasn't turned up yet, so we're all keeping our eyes out for it.
I did see something this week, so I have seen the template, so they're getting there with it. You'll be glad to know.
Fabulous. So we've got a question here. Will patients' contact details come through to the booking system? So on QFlow, will they be able to see who's booked and their contact details? Yeah.
Yeah, Louise, but that's based on, as kind of Illyri said earlier, if they've said that they're happy for it to be shared. So there are some chances where if you are cancelling appointments, some of them won't receive that notification because they haven't shared their details. But yeah, by and large, contact is there.
Just another thing to add to that, we do give users the option to add a landline number because not everybody has a mobile phone or an email. So in that instance, they will not get a SMS confirmation, booking confirmation, but we provide that so that if sites did need to cancel an appointment and they notice that it's a landline number that's attached to the user, then the site can take on that opportunity to speak to the user themselves and let them know that their appointment is being cancelled by the site. But it's just a way that at least that user isn't left without any information being passed to them.
Brilliant, thank you. Question here about the system again, about stock control. So is there an inventory feature within the system to help with stock control, so to inform the clinic if the stock is running low, etc.? Nothing that sophisticated yet. Maybe a build for the future. And the final question I've got at the moment is around somebody's login details. So it's the person here says, my login details say the same username, says the username is the email address and the password is an existing password. Is this the same as when I was at the COVID vaccination centre?
Yeah, it will be. So this will be a user who has already been on MBS previously or been on QFlow, and therefore it'll be that password.
Brilliant. Oh, we've got another question coming through. They're coming through. It's still coming through. So any more questions, please keep adding them in. Does MBS use the date of birth for patients who are 64 and will be 65 by March to determine the correct vaccine?
So vaccine allocation isn't happening on MBS level. So these are appointments. The vaccine allocation will happen at point of care. So at the pharmacy, the clinician will determine what's going into the person's arm. So we don't, it's not, the calendars aren't set up in that way. But we do an age check. So if the individual falls within the boundary of the flu season, then they are able to book an appointment, but we don't allocate them a vaccination that they should receive.
Thank you. Thank you. There's something else in the chat, I think. Is all the paperwork done online? i.e. when a patient attends, how do you check them in, write up the batch numbers, etc.? What is the procedure?
So I think that's down to your pharma outcomes or whatever system you use to record.
Yeah.
MBS is just booking the patients in. So as I understand it, Danny, correct me if I'm wrong, that they'll just get a list of patients for that appointment, you know, the afternoon or whatever. And then it's up to them to enter the records how they want to record them on their clinical systems.
Great, thank you. We've got another question here again about vaccine numbers and supply levels. Can you add how many vaccines you have left into the system so it knows when to stop accepting bookings for a certain vaccine?
Not that
No,
No.
in that instance, what we'd recommend is that you remove your availability. So if you know, when I went through earlier and added it in Diary Manager, if you see that actually you're running out of stock of a particular thing, what we'd say is then you go back into Diary Manager and either remove that particular kind of appointment type, depending on the age, or remove the availability entirely. If you delete that, if you say, right, I can say I've got enough appointments now and I'm going to run out of stock, so I don't want any more bookings, be aware that all of the appointments will still stand. So deleting that availability won't delete any of your appointments. They will still stay there. It just means that no future people can book in.
That makes sense. I think what's important really is that you keep a really close eye on the number of bookings that you've got, don't you? And make sure that you're not exceeding bookings with the supply you've got in the pharmacy. I've got a question here. It says my flu site is linked to a COVID site, and I'm also involved in, which allows everyone on that COVID site to view. Should I not just be linked to my personal login?
The challenge with QFlow is it's all kind of reliant on user access. It is quite a challenge. So if you are somebody who is managing both COVID and flu, we have to link them together in order for you to see those sites, unless you were to give us different email addresses. Now, if I've linked them together in a group, it doesn't mean that I've promoted anybody else's access. So if you look at that top level, I would expect that nobody else within that group would see it. If that is the case and it's not appropriate for them to have access, you could choose to either sign up with a different email address and we can just assign your email address that's separate to the flu site, or B, let me know and we could do it. So it's kind of like a COVID subunit and a flu subunit, and you only have access to both.
Brilliant, thank you. Got a question here about patients being accidentally vaccinated twice. So it does say, is there a way to stop patients getting multiple vaccines? Will the booking system recognise that somebody has already been vaccinated?
Yes, so one of the checks we do is to check their NIMS record, so allowing for NIMS being updated from the time they were jabbed to when they're trying to book, which I think is 6 hours that once is updated from point of care. So allowing for that time, then yes, we check that the person hasn't had a record in the current flu season, and if they have had the record, we show them. I didn't show it in the journey, but they do see a screen saying that they don't need to book or use the service, and if they have any questions, we post them to their GP or to a healthcare professional to speak to.
Thank you. A question here around bookings. So will bookings come through on email when they are made, or will we need to be checking QFlow regularly?
Yeah, you'll need to check back regularly. There's no kind of notification to emails when bookings are made.
Thank you. Another one here, can the functionality allow the patient to book COVID and flu at the same time if the site is offering both?
No, unfortunately not at the moment. So at the moment, patients would be expected to book them both separately. In the call and recall letters that are going out, we're going to be kind of encouraging patients where possible to just book one appointment or the other, and kind of seek to get co-admin, or patients, if they prefer, can book their appointments separately. But no, at the moment they can't book them both.
Thank you. Got a question about audit, and maybe one for you, Suzanne. From an audit trail point of view, are we confirming patients booked at our pharmacy actually attended and had a vaccine?
Well, I think that's up to the site to do that if they want to do that, and I'm not sure that it's an obligation to check that that's the case. So I think it's up to the site if they want to do that.
It's quite an interesting exercise, isn't it, to see actually how many you got booked and how many were outstanding. But yeah, there's no need for you to do that unless you choose to do that for your own internal audit purpose. Question here, can you access QFlow from your mobile phone, or is it just via a computer?
I actually don't know. I'm just trying on my mobile now. I'll come back to you on that one.
That's us on that one. Thank you. I can't see any more questions. Has anybody got anything else they want to ask? I have got somebody with a raised hand. I'm not sure if that person wants to speak or if they've already had their question answered. But otherwise, I can't see anything else. Any other questions there at all?
Yeah, can I?
Yes, go on.
Sorry, can I just make a point? I take it that if we're using this system, that we're still allowed to use our normal systems of booking people in as they are walking into the pharmacy. Is that still correct, or is it just one or the other?
No, of course, yeah. We encourage walk-ins. Yeah.
Yeah. So I think something that we need to be mindful of, it's just really more a comment than a question, is the potential overbooking, because obviously the stock has been ordered and we've not really got a lot of room to maneuver on that. By the looks of things, I think availability of stock for pharmacies to access now is going to be very limited. And probably limited to what you've already ordered. So when you're looking at your bookings through this system and coupling that with sort of anything else that you do over and above through your own pharmacy contacts, it may well be that people are getting booked and then perhaps you've got not enough stock. So I think, is there a facility for us to contact patients, or what's the mechanism of contacting patients if you haven't got the stock to fulfill a particular booking on a particular day? Sorry, did I make that clear? I'm just trying to...
Yeah, I don't know if Danny wants to come in on lessons learned from COVID, but we normally tell sites to only put up what they've got vaccine for. And I mean, if you're used to having, I don't know, say 10 patients a day walk in requesting vaccines, then you might obviously want to take that stock away from any stock that you want to put up on MBS. I think it's very important that you manage your stock levels and your MBS appointments quite closely. You know, you don't really want to be ringing patients to tell them that you've run out of stock, I guess.
Yeah, so I think maybe the sort of best practice tip is really probably only to go so far ahead.
Yeah.
But the problem is, I don't know what other pharmacies are like, but it's very unpredictable. You know, you can't always sort of tell how many you're gonna have on a particular day. It's not an appointment system. We've never worked on an appointment system in most pharmacies. You just don't know what sort of a day you're going to have, whether you're going to have a rush, whether you're going to have a very quiet day. So predicting the flow of people for the vaccination service is really, really hard. So yeah, it's just something to be aware of, really.
I guess where it may work well is if you sort of have a locum on a Wednesday afternoon for a flu vaccination session, that you put that up on MBS, so that you know patients can book in and you can manage your workflow that way. Sati, did you want to come in on that?
Yeah, I do. We have this issue all the time with all the COVID sites that they're on grab a jab where they're going to get those walk-ins, and then obviously they're on MBS, and we encourage them to really manage their stock, because with the COVID sites we can get them some vaccine by mutual aid, but with flu, we can't get you anything, so you really have to manage your own stock. And that means, obviously, if you've got 10 to 15 people you know are going to walk in, you need to make sure that kind of you don't leave yourself short, because kind of as a region we can't even come and support you, or your colleagues can't as well. So it is going to be the fine line. So what I'd say is just be wary of how many appointments you put up initially, and then once you get a bit more confident, then you can put more up. So at the moment, just do a few, maybe an hour a day, or how many you think you can manage, and then take it from there, because it is going to be tricky just trying to manage those both at the moment. And then obviously once we start advertising, that you'll have many more walk-ins as well, patients coming through. So so you've got to watch for those too.
Sure. Yeah.
Thank you to Susanna and to Ali for confirming that you can do NBS on a mobile phone. So we know the answer to that one now. Got a question here about claiming for vaccines delivered. Do we do it in the normal way? And yes, you do. You would just do your normal claim as you would normally do. Question here, maybe for Danny, I'm not sure. Can patients book for the same day? So if the pharmacy checks in the morning for bookings, can more people book in that you may not notice if you don't check again, or is there a cut-off?
I could answer that one. No, citizens can't book on the same day for an appointment, but they can cancel on the same day. So what we've allowed to, just because we know that there'll be multiple ways that people can, get vaccinated. So if for whatever reason they've booked an appointment and then they get vaccinated in another site, we sort of want to give the user the opportunity to cancel the appointment, when they remember. So I imagine a scenario where you're prompted that, oh, you've got an appointment, but you've already been jabbed whilst we're getting shopping or something like that. So we've allowed the user to cancel up to an hour before. So the list might change. If you sort of print it off in the beginning of the day, it might change with users cancelling it, but they can't book on the same day.
Thank you. We've got another person here who doesn't have any email or details sent to them. It's Sajil. Sajil, if you could just pop a message into chat and just send that message to me, I'll make sure it gets to the right person to follow up. You could just include your ODS code of your pharmacy, your name and your email address. We'll follow that up for you later. You've also asked Sajil around, you're an independent, asking, will you know who in your area is also using the booking system? I'm not sure that information is going to be shared. Is it, Amanda, as to who it is? Who?
I don't think we thought about sharing it. I mean, obviously you can go through the patient journey and see that way. Would that be useful to people?
It might be, yes, yeah.
Yeah, Sati and I can pick that up then, perhaps.
Thank you. We have got a message from Suzanne. I don't know if you want to pick that one up, Suzanne, your message in the chat.
Yeah, I've had a colleague express some concern that they know that doctors are already vaccinating people who are over 50. So there's a concern about how many patients will actually be available from the 17th of, no, we're not allowed to till the 17th, till the 15th of October. So it's a bit of a concern that how many patients will be left. So I don't think there's anything we can do that and answers that question here.
No, but it is a concern. Yeah, I have heard that GPs are vaccinated as fast as they can for the 50 to 64-year-olds. So yeah, interesting to see how that works out over the next few weeks. There are no more questions. I think we've captured all the questions in the Q&A and the few that have come through in chat. Is there anything that we've missed? I don't think that there is. Any more questions? If you could pop them on there really quickly. Sajil, I've got your details now, thank you. Sajil's also asked when and where are the drop-in sessions. So I suppose if I pass you his information on, Amanda, you can ensure that that information is passed on to him about the drop-in sessions next week. And Lucy's just said that Bruce has already sent through a list of the branches that are signed up for it. So I'm assuming that everybody's already got that, but I'm not 100% sure. I don't know what he sent out. So there's that information there as well.
Louise, can I just ask, you know, the drop-in sessions, do you want to just, Danielle, send me the details through and I can send them out to all the sites so that they have them so they can just drop in whenever.
Sati, they weren't in the onboarding letter, so there is a link in the onboarding letter, but yeah, we can do that again.
Yeah, I can do that again, yeah.
Yeah, just sending out a reminder is always helpful, isn't it? And yeah, there was definitely no more questions coming through that I can see. So I'd like to say thank you to everybody for joining us. I know it's a big ask in an evening, but it's really important pilot this, not just for us, but for nationally. And this could make a real difference to how we manage our flu bookings in the future. You know, it's been a real success with COVID, hasn't it? So fingers crossed we can make this real successful for flu for the future for us as well. So we need everybody just to try the best and give it a go, and appreciate there may be some challenges along the way, but you know, please talk to us about those, either to Amanda and her team or to us at the LPCs, and we can make sure things are fed back if you've got any problems or things you want to talk to us about. Oh, I've got another question. There's always one. Can new pharmacies join in the future, or is this it for the pilot for this year?
Yeah, this is it for the pilot this year, but obviously we'll review how the pilot goes and maybe be able to offer it out to more sites next year.
Fabulous. And I think that's everything else. Have you got any closing comments, Amanda, that you want to make? Or
just to say thank you to Louise, and thank you for everyone to joining us and participating in the scheme. Good luck, everybody. Thank you.
Thank you.
Thank you, Louise.